Hello, my name is Clara. I'm one of the neurology residents, and I'm going to speak about abnormal episodes and mimics of seizures for the Langford Academy. Right, so I suppose everyone is been in this situation where you're basically in practice, you're taking a consult, and the owner is describing an episode that they're fairly convinced it was a seizure. But you start to wonder, wait a second, this doesn't really sound like a seizure. There is some bits and bobs that don't really match. And I guess there is a list that I've put here for you to maybe try and memorize, because it's quite useful to know what things may mimic your seizures. And I suppose if the episode is typical and is described as generalized tonic-clonic seizure, then don't worry, you don't need to overanalyze. But I think you'll probably encounter episodes being described as maybe a bit longer, or not having a postictal period, or just generally not sounding consistent with what we think is a seizure. So vestibular events, movement disorders, REM sleep disorders, which maybe you've never heard of, as they're not common, syncope, narcolepsy and cataplexy, compulsive behavior, neuromuscular weakness, and also response to pain, are all things that we need to keep in mind. I guess my advice is to try and characterize the episodes the best as you can. And personally, the way I find is best is to take or to get a video from the owners. I always recommend obtaining a video just before I proceed with any, say, invasive investigation. So you might want to start with some blood work, that's absolutely fine. But I guess the risk of undertaking any unnecessary and costly diagnostics is considerable. So it's just highly unlikely that a serious condition in an otherwise normal animal would manifest in episodes that are so brief that they can be recorded. And so if you can, I would say to the owners, look, a period of observation is a reasonable advice. It's probably not going to pose any significant risks. Serious diseases tend to progress to the point that there is interictal abnormalities, or that they show abnormalities on your blood work, and they're obvious to you and to the owner. If the animal is otherwise completely fine, then I think taking a moment to wait and record an episode is probably worthwhile. So I've got a few video examples for you here. These are one of my favorites that I've been sort of collecting from years in practice. The first video example I've got for you is a dog having a syncopal collapse. This dog had a suspected arrhythmogenic right ventricular cardiomyopathy, and as you can see, it is collapsing. The episode is very short lasting, and immediately the dog gets up and seems to be, and I can promise you, absolutely back to normal, which doesn't quite match a seizure, because you would expect to have a potentially pre-ictal period as well as a post-ictal period. On the other hand, we've got this video of a lovely Labrador who's having a vestibular event. It was described by the owners as potentially a seizure, but actually when you look at her, yes, she's recumbent, but she appears to be conscious, and something about her eye, so she's actually displaying horizontal nystagmus, which you don't typically get with seizures. So these already raise concern for potentially a vestibular event rather than a generalized tonic-clonic seizure. These episodes also lasted quite long. I think it was reported as 10 to 15 minutes, which again didn't quite fit with a seizure. Paroxysmal dyskinesias are a group of involuntary hyperkinetic movement disorders, and this is a condition that is frequently mistaken by a seizure. I really like movement disorders in general. I think based on video footage, we've managed to actually sort of characterize a lot of these movement disorders in the last decade. And we might have come to the conclusion or realized that a lot of what we thought were seizures in the past might have not been seizures, but potentially paroxysmal dyskinesia or movement disorders. These episodes tend to be longer than 5 minutes. Dogs remain completely conscious, and you can get signs of muscle contractions, but these are typically what we refer as dystonia. Sometimes you can get tremors and ataxia as well. These are really good to get a video of, and I think if you're wondering, I would encourage you to get video footage before. The one in the middle is recently characterized movement disorder, namely episodic ataxia in young working Cocker Spaniels, which is characterized by sort of cerebellar signs of hypermetria, cerebellar ataxia, head sway and titubation. And then on the last video I've got for you here is a dog with idiopathic generalized tremor syndrome, which is also easy to mistake for, I guess, a seizure because the muscle tremors are so severe. So I guess one of the key aspects in these videos you might be already thinking is that this dog is conscious.